Locating credible research databases for medical students. Introduction. Patient care at medical surgical units of hospitals is more complicated than ever because of the enormous amount of information that needs to be considered for the treatment design. Hence, it is essential to collaborate in teamwork to build effective work relationships, share resources, and solve problems. As a baccalaureate-prepared nurse, I can share my knowledge and skills in allocating the resources needed for specific diagnoses and cases. I can also use my experience locating credible databases and research to supply my colleagues with the most recent evidence-based findings. Moreover, there are strategies for sharing the background and experience to stimulate the relational development process. Although there could be an issue of going too personal, it is the most effective way to collaborate. In such a way, by making sound argumentation, the professional can stimulate colleagues to pursue evidence-based practice and do regular searches. Furthermore, small discussion sessions could be organized to analyze the new information and assess its compliance in practice. This paper will focus on credible research databases that medical professionals and students can use to identify reliable healthcare information. Credible databases for research. The case discussed for the assessment of the online databases is thrombolysis for the treatment of deep vein thrombosis. The first resource that could be addressed in this setting is the Journal of Cardiovascular Nursing. It provides contemporary and detailed nursing practices in different complications and reviews to make conclusions and decide on evidence-based practice. The next reliable database for searching scholarly information is Medscape due to the questions and answers section where the cases from different scenarios are discussed. Such data could be used to compare effectiveness using the background knowledge from the courses and personal experience. Even though it is not as targeted explicitly at nursing professionals as the previous resource, it provides a vast amount of information that could be narrowed down using keywords. Websites like JSTOR and Google Scholar can also help find information on healthcare issues. The following resource is applicable only for the given particular case. The third source is the journal Cardiovascular Diagnosis and Therapy, which provides specific information on deep vein thrombosis. It should be highlighted that this opportunity is essential in a medical surgical setting as the decisions in such an environment usually are made in a rush. This resource could be used for the general understanding of illness and its management. Reading available reviews of the nurse's actions, particularly for patients with the same diagnosis, can help plan the necessary operations to handle. The fourth database for the investigation of the case is one of the oldest and best medical journals, The Lancet. It is of particular interest because of the high impact factor and being peer-reviewed by experienced professionals. Although the amount of information in this journal would not be as specific and pervasive, it is highly reliable for the preliminary assessment of the topic. The fifth resource is one of the comprehensive databases. The Cochrane Library is scholarly because of its peer-reviewing policy and features useful advanced search that is helpful in the specific investigation. Conclusion. To complete the necessary research and resource exploration, professionals can use computer labs with online libraries. It should be noted that some of the resources may not be available for free use, and individuals might need a registration or subscription. For example, Medscape and The Lancet can be accessed with free registration. Although some hospitals provide the representatives with such incentives, mostly, it is accomplished by using the hospital access to the libraries. In such a way, the information necessary for professional, evidence-based practice can be accessed even if the nurse has not encountered the diagnosis before.